Hello. A variety of inhaler devices are available to treat lung conditions. This video will show you how to use your pressurized metered dose inhaler with a small volume spacer device. If you use your inhaler correctly, you'll get more of the medication into your lungs, giving you better control of your breathing problem. But if used incorrectly, you may have poor control of your condition, with the risk of side effects, such as a sore throat or mouth infection. A spacer is an attachment which makes it easier for you to use your pressurized metered dose inhaler, especially if you find it difficult to coordinate pressing the inhaler and breathing at the same time. It also helps to get more medication into your lungs. There are different makes, shapes and sizes of small volume spacers available, but they all work in the same way. There's a mouthpiece at one end, and at the other end there is a hole for you to attach your inhaler. You should always sit upright or stand up when using your metered dose inhaler, and hold it in a vertical position, like this, when you load and use the inhaler. Remove the cap from your inhaler and spacer. Hold the inhaler upright and shake it firmly 4 or 5 times. Insert it into the spacer. When you're ready, breathe out gently as far as you comfortably can, but not into the mouthpiece. Place the mouthpiece of the spacer into your mouth and between your teeth, but don't bite down on it. Close your lips around the mouthpiece to form a tight seal. If you're using a spacer with a mask rather than a mouthpiece, place the mask over your mouth so that there's a tight seal around your face. Press the top of the inhaler down and take one slow, deep breath in, whilst keeping your lips sealed around the mouthpiece. If you hear a whistling sound, you're breathing too quickly. Hold your breath and take the spacer from your mouth, but continue holding your breath for 10 seconds, or for as long as is comfortable. Now breathe out slowly. Remember, it's important that you breathe soon after pressing the inhaler. Otherwise, the medication will fall to the bottom of the spacer instead of going into your lungs. If your doctor has told you to take 2 puffs, wait for 30 seconds and then repeat the whole process. It won't help if you take several puffs without waiting, and you must always firmly shake the inhaler 4 or 5 times between doses. Once finished, replace the cap on the inhaler and spacer to keep dust and moisture out. If your inhaler contains a steroid, brush your teeth or rinse your mouth with water and spit it out after every use to prevent mouth infections. Ask your pharmacist if you're unsure whether your inhaler contains a steroid. It's important that you look after your spacer, and here are some tips. Ensure the spacer is the correct one to fit your inhaler and that it's the right size for you. Wash your spacer weekly. Follow the instructions in the leaflet provided with your spacer. Before washing, remove the section that holds the inhaler but not the section you breathe through. Soak both parts for 15 minutes in lukewarm water with mild liquid detergent such as washing up liquid. Agitate gently. Shake out excess water. Do not rub dry. Leave it to air dry at room temperature in a vertical position. Replace the section that holds the inhaler when the unit is completely dry. Store the spacer in its carton to keep it clean. Your spacer should be replaced at least every year, especially if you use it daily, but some may need to be replaced sooner. If you're unsure about how to use your metered dose inhaler, speak to your GP, practice nurse or pharmacist for assistance.